We begin by drying the area with gauze. Next, we apply a topical anesthetic to the area using a cotton tip applicator. To maintain dryness, place a saliva ejector in the corner of the mouth. The assistant positions hand over the patient before the doctor begins the numbing procedure. This helps block the patient's hand from reaching for the doctor's hand during the process. We always rinse after numbing, so assistant should always be ready with the air water syringe and saliva ejector. Place saliva ejector in the mouth first before spraying water. Fold the tail of the dry shield and gather the sides before placing it in the mouth. The patient can rest their teeth on the bite block after teeth are fully isolated. We're ready to start. When the doctor reaches for the high-speed handpiece, the assistant will reach for the clear dip gauze and the air water syringe. Notice that the assistant's right index finger is resting on the air water syringe tip. This is the correct and the only way you are going to hold the air water syringe. Before starting, the doctor or the assistant will inform the patient to raise their left hand if they feel any discomfort. With the dry shield ready to go, the doctor starts removing decay. The assistant sprays air on the tooth and the mirror every time the doctor stops to check the preparation. The assistant also wipes the mirror with the clear dip gauze. When patient raises their hand, the assistant will also give the signal to the doctor or say, "Stop." The assistant is spraying air on the mirror to clear it from water droplets while the high-speed handpiece is being used. We are now going to prepare for the placement of the composite. This is an MO filling, so we are going to use a sectional matrix. While the doctor is placing the sectional matrix, the assistant will reach for the wedge. Hold it by the tip end when passing to the doctor. The assistant now reaches for the mouth mirror so the doctor can check matrix placement. Next is the clamp holder, with the clamp in place. The assistant passes the mirror again and the spoon excavator. We are now ready to use the etchant gel. The etchant gel syringe is placed back on the leftmost part of the composite procedure paper. The assistant gets the HVE ready in order to catch the etchant gel while rinsing it off. While the doctor is drying the tooth, the assistant reaches for the purple brush dipped in gluma and applies it to the tooth. While the doctor is air drying the tooth, assistant reaches for the yellow brush or the bonding brush dipped in adhesive or bonding and the flowable composite. The assistant positions the tip of the curing light parallel to the surface of the tooth and then turns the curing light on. Look through the orange shield to protect your eyes from the bright light. While the composite is being placed, the assistant reaches for the composite instrument. The assistant now reaches for the yellow brush or the bonding brush. While the doctor is using the bonding brush, the assistant reaches for the explorer. Gauze, on the other hand, ready to wipe off excess composite. The assistant hands the yellow bonding brush again. At this point of the procedure, the assistant can place instruments back on the table and get the curing light ready. Position first, then turn the light on. We are removing the clamp once curing is done. And the wedge, then the sectional matrix. The assistant will cure the composite again, focusing on the proximal surface involved. The assistant must also cure other surfaces if it involves multiple surfaces. We are using the high-speed handpiece again to remove excess composite. The assistant holds the air water syringe and the clear dip gauze. The assistant is handing the floss, holding it at both ends when passing. When removing the dry shield, always have the saliva ejector ready to suction excess water or saliva in the patient's mouth. We ask the patient to open their mouth wide, turn the dry shield sideways, then we pull the dry shield out. Use the saliva ejector to break the stringy saliva attached to the dry shield. Place suction in the back of the mouth and have patient close down on the saliva ejector. Air dry tooth and use the articulating paper. Position articulating paper on the occlusal surface of the upper teeth. Have patient tap their teeth together several times. It is a must to protect the tongue when working on the lower posterior teeth. Assistant uses the mirror to retract the tongue by scooping the tongue up and pulling it towards her. With the tongue out of the way, the assistant can now position the HVE close to the tooth. Patient can close on the HVE with the lips just in front of the small opening at the tip of the suction. Air dry again and check bite with articulating paper. The assistant uses the other end of the articulating forceps to retract the tongue. Position the HVE as close to the tooth as possible. Once we are done with adjusting the composite, we are now ready to polish tooth with an enhanced point. This creates a lot of residue on the teeth, so we need to rinse out the mouth as many times as needed. Wipe off blue marks on the other teeth with gauze, or have patient bite down on a piece of gauze.